Hello everyone, my name is Chris Geddes. I'm multi-manager for Docs Innovent, manufacturer of vgel supraglottic airway devices. We recently launched the vgel advanced devices for cats and rabbits, and I'm here today on video conference with Ivan Krotas, veterinary consultant for Docs Innovent, to talk about how the new vgel advanced devices differ from the original vgel devices. So Ivan, first question, how does the shape of the vgel advanced differ from the original vgel devices?
Hi, Chris. Well, quite a bit. The original V-gels used soft, wide cushions, and those cushions matched up to the laryngeal anatomy, and that match created the airway seal. Now, we've worked with a whole bunch of international opinion leaders and obviously internally in our own group, and we've created the vgel Advanced. vgel Advanced devices use a soft edge seal, a thin seal, and that seal wraps around the larynx without touching it, and then seals down on the floor of the pharynx. So what we've got here, you can see I have a size 2 vgel Advanced device, and you can see those thin, flexible edge seals. So the larynx sits in that space, and we've got a ventral surface here, dorsal surface here, and then these edge seals seal around the larynx. We've got a size 2 rabbit vgel Advance here, and again, you can see those very thin, flexible edge seals there that wrap around the larynx and give you an airway seal. Now, one of the big advantages of doing it this way is that you leave the larynx free completely in the center of the airway, and specifically you leave the epiglottis sitting in a natural position, and that epiglottis can then work to direct fresh gas flow in and out of the larynx during respiration.
Okay, and how does the change of the shape change the nature of the seal?
Well, that was one of the big things. Key opinion leaders wanted to use the V-gel for more advanced procedures where you're using an actual ventilator. And for ventilating anesthetics, you'd aim for a seal pressure of about 15 to 20 centimeters of water, something in that range. And on most patients with a V-gel Advance, you can expect seal pressures of around or over 20 centimeters of water for both cat and rabbit devices. So that makes them appropriate for spontaneous respiration, so that's your general practice anesthetics, IPPV, where you're bagging those animals, or ventilated procedures with an actual ventilator.
Okay, and the dorsal inflatable section that was present on the original cat device is not present on the vgel Advanced cat, is that right?
That's correct. So we didn't need to. Changing from the original seal design to this advanced thin edge seal design, the V-gel performs so well that we didn't need any extra complexity to change the seal. It works very, very well just in this simple format.
Okay, and can you tell me why the new devices are single use?
Yeah, absolutely. The major reason for making any medical device single use is to eliminate the risk of cross-contamination. And of course, that's just as much a problem in veterinary anesthesia as it is in human anesthesia. We were also finding with the original V-gels that we got very common occurrences of damage from cleaning procedures, either cleaning chemistry or temperatures with autoclaving. And of course, that means that you're damaging a very expensive device. When you start to make single-use devices, the initial outlay for stocking these devices in the first place is much lower, and that means it's much easier to keep a wide range of devices in stock, both range of sizes and range of species.
Okay, now, the dead space connector is an important feature of vgel Advanced, isn't it?
Yes, absolutely. So of course we're making devices here for small patients, for cats and rabbits, and keeping the dead space very, very small is vitally important for your small patients. So if you see the V-gel here, this is that cat size 2 again. This portion here, the transparent portion, that sits within your anesthetic tubing. This portion here has the excessive volume filled while still maintaining an airway that's wider than the trachea, and that's the critical point. If you maintain the airway wider than trachea, you're not adding any extra airway resistance, and airway resistance is also an important factor when you're dealing with small patients. So you've got this relationship between optimum airway resistance and optimum dead space.
Okay. Now, you do a lot of dentistry in your clinical practice in cats and rabbits. How do you find the vgel Advanced devices for dentistry?
Pretty good. I've been using vgel Advanced with dentistry for cats and rabbits for some years now, and we've improved the design over those years for dentistry for both cats and rabbits. So you've got this portion here, and you can see similar thing with a rabbit device. And that sits against the pharyngeal arch at the back of the mouth and stabilizes the vgel. The key difference is that we've then removed material bulk in the oral section of the vgel here. And that's obviously very important from a surgical point of view. So you can take that material bulk away without affecting the width of the airway and without making that airway narrow and difficult to breathe through. You've now got a much more flexible oral section, and you've got much more visibility for surgery for working around. So you've got more access to dental structures, and it's easier to move it around in the mouth. One of the other things that people are concerned about is aspiration of oral cooling fluids during dentistry. So a cuffed endotracheal tube, that places a seal low down in the airway, and that doesn't offer you upper airway protection. vgel Advanced has this seal that goes around the larynx, and that does offer better protection, but you should still, when you're doing dentistry, you should take all the normal precautions against fluid entering the pharynx in the first place.
Okay. How does the sizing guide differ for vgel Advanced compared to the original devices?
Well, there's still 6 sizes for both cats and rabbits, but with cats, we used to have short versions and long versions. With the changes with the new design, what we've been able to do is make a scaled range in cats that takes you from very small cats up to very large cats. So those 6 sizes now cover very young cats. That might be your early neutering cats, something like that, that might be more difficult or dangerous to intubate, right up to very large breeds. The rabbit sizes, there's still a range of 6 different sizes, covering small dwarf rabbits up to genuinely large breeds.
Okay. And is it easy for vets, nurses, technicians to transition? People that are used to the original devices, is it easy for them to transition to vgel Advanced?
Yes, it's very easy to change over. If you've used vgels before, there's very little adjustment to technique. You do the same things as you've always done. You just have the advantages of the better seal and the better flexibility for dentistry and all those things. As with anything, we have training material online. There is a user guide for vgel Advanced, and as with any device, read the instructions, watch the videos, make sure that you know what you're doing before you start to use them. But basically, if you've used vgel before, you can use vgel Advanced.
Great. Thank you very much, Ivan. Anyone has any other questions, please get in touch with DocsInnovent and we'll try to help you. And please have a look at our website, docsinnovent.com. Thank you.